Great honour to be speaking at this Congress. It's also quite anxiety making. I'm used to teaching vets, and to be talking to a group of highly professional, multicultural, multi-professionals from all over the world is quite daunting. So I thought, what shall we do to stay on safe ground? I'll cop out and do something simple. So one of the other reasons for picking this as a subject is because what I've become aware of over my several years of practicing homeopathy with animals is that we all look for the Holy Grail, and most of the most inspiring presentations at congresses are the fantastic cases of the rare and wonderful new milk remedy or latest lanthanide, etc. Now, I have a colleague who does that, that's Jeff Johnson, and I don't do that very much. I aspire to do what Jeff does, and sometimes I try lanthanides, and sometimes I try tiger's urine, and sometimes I have a bit of success. But some of the greatest strengths of homeopathy is what we forget is like the ordinary stuff. It's like the arnica, it's like the hypericum. And a lot of my work, probably 50% of the patients that come to me are old patients. The dog is the patient, of course. Quite often they're old clients as well, and they become older as we go along. But now, sometimes it's the simple stuff which is best. Now, to remind me of the title of the Congress, Healthy Patients, Healthy Practice. So this is going to be a little bit different. This is going to be Dying Patients, Healthy Practice. But when you're treating animals, you know, we treat them, the difference, it's sometimes been said within faculty circles, there's always this idea that the vets are somehow different from the doctors. We are different from the doctors. We do different things. We're one-man bands very often. We do the consultation and we give the medicines and we do the x-rays and we do the surgery, and sometimes we take the money afterwards and we sweep up before we go home. So, you know, we do it all. And that's a great joy actually, because we have control. So this is something that we can do very adequately. So we're going to look at the geriatric animal. Before I go much further, I should issue the statutory warning before I teach any new group, which is that there are three things I love talking about. One obviously is homeopathy, the other is football, and the other is myself. I'm going to try and stay off myself a little bit, but I'm going to talk about my dog. As an Englishman in front of a multinational audience, I think we should probably stay off football as well. I'll do my best. Also, the other warning is that there may be some very, very poor jokes going through. We'll see how we go. So the word geriatric comes from, you probably know this, comes from the Greek words geros, old age, and iatrikos, of healing. There's an alternative translation, which is the leader of Sinn Féin scoring 3 goals in a match. So Jerry hat-trick. That might be the last joke. So on senior dogs, I don't know where I got these figures from actually. I suspect I stole them from Sue Armstrong, who was the first person I saw give a presentation like this. And actually, you know, I've transferred them into talks over 4 or 5 years, and I think they're completely wrong. This is a conventional idea of when a dog becomes a senior dog. It's when it gets its rail card. Small breeds over 8 years. Small dogs don't get old until they're 9, 10, 11 quite often. Medium dogs, 7 years. I would up that as well, probably 8 or 9 years. Certainly large breeds, the giant breeds, you're lucky if you get a Great Dane to live more than 7 years. But you could still extend that a little bit. I suspect, to be perfectly honest, that these figures have come from the manufacturers of a drug called Vivitonin, which is a cerebral artery dilator, and it's the same sort of issue as statins for humans. That several years ago they said every old dog should be on Vivitonin, and this is when they should start. So we have that stuff in the veterinary profession as well. So this is my view of what's happening with an old patient. What's happening is that they're actually starting to shut down. On some level, they're sort of getting prepared to move on. So they start to shut themselves off from the world in preparation. So they shut themselves off from the world and they withdraw. Their hearing goes, the eyesight goes, loss of sensation, and this is all part of the preparation. Mentally, they lose their memory, they may forget their training, including toilet training, they become more dependent, might become more clingy, they tend to close off, might become a bit more impatient and irritable, and I'm sure you recognise this in human patients as well. We don't actually have a diagnosis of Alzheimer's disease in animals yet, but I expect it will come. We do have a diagnosis of senility, which is far too easily thrown around. There are, of course, as you will be aware, 3 advantages in having Alzheimer's disease. One is that you meet new people all the time. The second is you hear new jokes all the time. And the third one is you meet new people all the time. So they get confused, there's a mental response to pain. Quite difficult in our patients to actually assess pain because they can't talk, can they, as they say. You tend to get depression, panting, irritability may be things that you notice, and sometimes things like carriage of the ears and facial expression will give you an idea. And there's a loss of appetite. Physically, we've got the degeneration of joints, back pain, weakness, incontinence, eye problems, conjunctivitis, ulceration, chronic coughs, hair loss, all the things that you would expect in humans as well. But these are all sort of separate parts of the getting old. So what's the challenge? The vital energy is becoming weaker. So homeostatic processes, less responsive, and responses generally are slower. So my experience is that they very often don't respond to high potency constitutional remedies. So all those wonderful miracles that you get from the single dose, you don't get in old people. We have to change the approach. For the same reason, they often won't respond to high potency remedies. So we have to take note of that. And the other thing that happens is that the vital energy seems to become unstable. So the symptom picture changes. They'll flip from one phase to another. Sometimes symptoms will come and go, sometimes they change overnight and you have to change the prescription. So it's a totally different approach from the one that we'd like to perhaps to have. And of course, we're not going to cure them. There isn't yet no cure for old age. So the challenge for the owner is to accept that this is happening. And this, in a way, is part of the plea to you as medical colleagues, is to understand this, because it's only recently I feel that your profession has started to really take note of this. There's a premature grief state where people start to worry the fact that they're going to lose their patient. This was one of my dogs as well. He lived till he was 16, and from the age of 10 I thought I was going to lose him. God, he's getting old, how long is he going to be here? And that was 6 years I spent in that state. You know, it wasn't a sensible thing to do. With proper management, the transition to death and death itself can be a positive experience. And one of the things that I've been quoted as saying is one of the great things about homeopathy is not only that homeopathic patients live better, they die better too. And I think that's really important. But it's one of the most difficult emotional phases of anybody's life. And I don't think we can underemphasize that. On a personal note, I've lost relatives over the years, cousins, father, mother, brother, and I've never ever been as distraught as when I lost him. And we're going to learn about him in a while. But, you know, it's an opportunity for us to repay these little friends that we have. They provide us with so much joy. And there comes a time when it's actually our opportunity to care for them and really look after them. So what can we expect to do? We can slow things down. A lot of this stuff is difficult to quantify, but occasionally you get the opportunity. I had 2 German Shepherds, or 1 German Shepherd as a patient many years ago. And German Shepherds suffer from a disease called degenerative radiculomyelopathy, which is, as it implies, a myelopathy a little bit like human...
MS.
Thank you, MS. It's incurable. If you have a pure case, and they aren't common because there's often lots of other stuff going around as well, but if you have a pure case of that, they respond very well to homeopathy. This particular German Shepherd lasted for 2 years after I started treating it. And around the corner was its sister, littermate sister, who developed the same symptoms at exactly the same time. And 3 months after diagnosis, that one was gone. So we get experiences like that tell us we're doing something. So you can slow it down. You can relieve the physical symptoms. You can lift the vital energy. And that's one thing that people are very good at noticing. Again, it's difficult to quantify, but they'll come in and say, oh, he brought his ball last week. That's the first time he's done that for 6 months. He just seems to be better. Often the words that preface the most important things are, I know it sounds silly, but. And the most common one is, my husband says I'm silly, but. That means you're onto something really important. And at the end, we can bring them to a gentle and a relatively painless end. So how do we do it? Local remedies, mixtures of remedies, ooh-ah. Look at the totality and the constitution, and if we can fit it into that, that's great. But even then, if we've got a constitutional remedy or one that fits the totality, then still go gentle, lower potencies. Low potencies, even LM potencies. We may need to give them intermittently. Quite a nice way of using them is 1 week on, 3 weeks off, or 1 weekend on, 1 week off, or continuously sometimes. And I tend to mix and match a little bit as well. Chiropractic, I think, is great. Acupuncture is wonderful. I don't use many herbs. The colleague I work with, Tim Cousins, uses a lot of herbs as a complementary therapy to homeopathy. That's how it should be, actually, isn't it? You know, we're not practicing complementary medicine. We're practicing medicine. It's the other stuff that's complementary. Antibiotics can be complementary. Yeah, corticosteroids can be so complementary sometimes. Notes on the materia medica. It took me years to work this out, and probably someone else would have done it sooner, but when we look at our materia medica, particularly have to say the bits of veterinary materia medica we've got floating around, there are actually 2 pictures. It was sepia that taught me this, first of all. You know, I learnt about sepia being irritable and snappy and wanting to hide away and not being sociable, horrible, miserable sepia. And I started finding that I was using sepia in young dogs that were happy dogs and friendly dogs and beautiful dogs and lithe, wonderful, happy, cheerful dogs. And that's the young sepia that turns into the old sepia. And because the young sepia is so sexy and so brilliant and so lovely, they're very, very fertile, so they have lots of kids. And after a while, that starts to bring them down, or they have puppies in our case. And so then they start to go into that sort of negative phase that we understand. The other thing, of course, that we do have, which you rarely have, is that a lot of our animals are neutered. And that sometimes seems to fix them in that young phase. So you can see a 7-year-old sepia dog which is still bright and cheerful and happy, because it hasn't gone through those hormonal changes. That's a huge issue at the moment in veterinary medicine, is the idea of neutering. We've found that there's a lot of research to show that it's actually not very good for animals. Male animals, even more so than females. Cruciate ligament injuries, for instance, are far greater, far more common in neutered animals. And cancers of various kinds are greater in neutered female animals. So it's a very complex picture. So the old picture results from a lifetime of operating in that state. And then you start to get the more pathological aspects of it too. When you read the Materia Medica, quite often these things are all mixed in together, and it's quite confusing. I have to confess I'm still a big fan of Borica. A friend of mine, Francis Hunter, said that Borica was actually written for vets. And I think he's quite right, because it does tend to lean towards the physical side. But it does tend to suffer from that mixture of symptomatology. Miasmatic picture, we see miasmatic pictures in animals, and I tend to stick to the basic 5 because I don't quite understand Sankrans yet. I keep struggling and attempting to, and I'm sure it is, well, I do know it is applicable to animals, but I still find the old basic 5 serve my needs. There's a lot of breakdown and destruction, so we're tending to look at more syphilitic patterns. There tends to be a predominance of mineral remedies, so we tend down to the bottom right-hand corner of the periodic table. There's loss of function and sora, and there's a loss of control, so very often there's excess reactions, so there's some psychosis there. So there's a good old mix there, which is why a lot of them are combined in the cancer miasm. And one of the things I've learnt in the world of homeopathy is that there are no coincidences. It's no coincidences that Liz has been talking about the cancer miasm before I get on here, and she's also talked, I think, about the tubercular miasm, which is my favourite miasm anyway, as we will come to in a moment or two. But certainly cancer miasm is very big. I'm not going to talk specifically about cancer treatment in animals. If I rush through this, and we've got a few minutes and anybody wants to ask questions about it, they may. But if you're interested in a resume of treatment of cancer in animals, then I suggest you go to the BAHVS website. That's the British Association of Homeopathic Veterinary Surgeons, where Jeff Johnsons has put on a wonderful little resume of treating cancer in animals, with 3 brilliant case histories as well. Just digressing for a moment, my partner Jane, who is sitting at the back there and is president of the BAHVS, has just received a letter from the Royal College of Veterinary Surgeons to say that the complaint to her as president about the website by the Good Thinking Society has been rejected by the Royal College. And soundly rejected, I would say. One of the amusing things in it is that they, in their submission to the Royal College, they copied Jeff's 3 cases of cancer. And the first sentence after that is to say, this implies that homeopathy can be effective in cancer, where there is no evidence to show that it is. Which didn't seem very good thinking to me. Here are 3 cases, but there's no evidence. Oh well, on we go. So homeopathic role for the patient: support them, maintain their quality of life through their old age and transition to death. a list there of some of the common remedy states. We're going to talk briefly about those as we look at some cases now. And the first one is my dearly beloved Bunny, Bunyip Bluegum Esquire, named after a character in an Australian children's book called The Magic Pudding, which is essential reading for every homeopath, alongside Winnie the Pooh. Yeah, he was a rather dapper little koala. So this is Bunny. He was picked up from I picked him up from a rescue centre. He'd been found roaming around Derby. After a year, he developed an allergic skin problem. These dogs come into our lives to teach us. That's like lesson number one of this presentation, really. As physician, heal thyself, then vet, heal thy dog, and take note of it when you do, because he's trying to tell you something. And this little bloke told me all sorts of things. The first thing he taught me about was the tuberculomyzum and tuberculinum. I suddenly recognised that. You will notice that I've had to have a microphone on here because I can't keep still, because I have to move around. Last night, actually, I didn't sleep very well. It was probably a fear of coming here. And my best way of getting to sleep is to count the number of practices I've worked in. And I usually fall asleep somewhere between Hobart and Warrington. Falling asleep before Warrington is actually a good idea, for those that don't know it. So this is Bunny, getting old. Cruciate ligaments. He was castrated. I actually did him. I picked him up from the rescue centre and said, don't spend the money. You would normally neuter him, I'll do it. At the age of 12, ruptured a cruciate ligament. This is one of the great things for homeopathy again. I used a little bit of acupuncture on him, but if you take that to the super vet, he'll charge about 4,000 or 5,000 quid for doing an operation on that. What is it Mark calls it? The TPLO, yeah, it's something to do with moving the patella. Totally pointless leg operation, yeah. Anyway, rest and RRA, Rustox ruta arnica. No household should be without arnica, probably RRA and calendula cream. Then ruta 30 and calc floor to tighten up the ligaments. Took around 6 weeks, and then off he went. And as often happens with cruciate ligament problems, the extra strain meant the other one went. So it was another 6 weeks then. But that was the age of 12, and it never bothered him again, really. 2011, this picture was taken in 2011, so he is now 15. During the winter, I had to carry him home because we were out walking and he suddenly went lame. Pain in the elbow. Rustox twice a day, 6C, and I improved it to 30C. And I switched at a later stage to strontium carb. I find that's really great for chronic sprains. So old cruciate ligament, strontium carb is a great local remedy. Then I added causticum. Causticum is like my number one favourite old dog remedy, actually, because it's so easy to pick. And you pick it because the dog comes in and you go, oh, you dear old thing. And that's that sympathy that the causticum patient has. Instantly, if you're open to it, is reflected. And that's the feeling of causticum, is that, oh, you dear old beautiful old dog, you're such a dear old thing, and he'll come in and do all this thing. He'll be a bit weak on his back legs, he'll have some pain down his spine, and he'll have a little bit of urinary incontinence and maybe fecal incontinence. Just slips out the stool, I think, is the way Gibson describes it. Medarinum I find handy for these elbow joints where you get lots of exostosis, so the occasional dose of that and occasional RRA. He then developed a cough, and on the day he was coughing, I finally got around to examining him for the first time for several months. and there was a bit of cyanosis on his mucous membranes. He had a bit of a murmur for many years, so I put him on Laura Serratius 30 once a day. Improved, his cough disappeared and his colour improved. There's a very specific reason why I use 30C potency there. I usually use mother tinctures for heart problems and find them really, really good. And I'll sort of mix and match depending on the symptoms. I used Laura Serratius 30 because we didn't have any tincture on the shelf. We only had 30C in the box. So I gave him 30C and it worked very well. So by July, he's having causticum and strontium every day, Laura Serratius, and the occasional RRA and Medorrhinum. He then developed a sudden urge to urinate on the carpet, and there was no physical reason for that. So I realised, I predicted that it was due to his mind. So I put him on Baritacarb, and here's a lovely picture of Baritacarb, timid little dog, sticking around the head. And he was starting to get into that Baritacarb stage of being a bit timid. What he didn't do, I'm glad to say, was go into the phase of Baritacarb, which is so recognisable and responds so well. And it's very specific. And owners come in and say he started barking at night, or when we leave him on his own. And it's a specific bark. And I'd like to demonstrate that to you. And it goes, so imagine middle of the night, all peaceful. Woo! Woo! Thank you. So and that is Baritacarb. You know, it's classic Baritacarb. I put him onto lithium. Lithium carb is great for the combination of heart problems and arthritis, and that, just as a keynote, is quite enough. It also has sort of alternating hip pains and one or two other interesting symptoms, but just that combination I find works very well in old dogs. So that's what he was on by December. He did have an eye problem, dry eye. I haven't mentioned on there for some reason. I put him on zinc, which is a sort of knee-jerk reaction for dry eye in animals. And sometimes it works, and sometimes it doesn't. And towards the end, he certainly, the Calibic and euphrasia and the artificial tears wasn't enough, so I put him on steroid drops. February 2013, suddenly got an onset of a slight head tilt, so it obviously had some kind of a cerebrovascular event. I put him on arnica and conium, which often works very well if they're circling to the left. And 2 days went on and he didn't improve, so we put him to sleep, and there he is. That's the old bunny. So this is what he finished up on, and what I would emphasize is that he was on all those. You know, you can tell when you're getting old, can't you, by the number of pills that you take, whether they're homeopathic or not. So that was Bunny. So, next case. Perfect, thank you. Half time, change ends. Okay, so, sorry, football again. So this is Maisie. This is a great case. I love this case, which is why I'm proud to present it. This is Maisie here. A Whippet cross. This chap, you will see, I've attempted to make this anonymous, as one should if one is doing medical things. We get away with things with vets. And most of my clients say, yeah, if you want to show it to a conference, go for it. And certainly this guy is the same. But the chap who brought this in is a lovely, lovely lad. They're all lads now. But he's about 45. No, he's in his early 30s, but he's a lovely, lovely boy. And he loves taking on old dogs. the rescue societies know that he's a soft touch. And it can be whippet rescue or it can be retriever rescue. They're the two main ones. And if they've got a dog that's difficult to home because it's an old dog, they will ring, let's call him Patrick. That may or may not be his name. So he picked up this dog, was diagnosed with renal failure, took it to the local vet. They said, renal failure, it's gone, put him to sleep. Some such compassionate words as, this dog needs immediate euthanasia. There is no possibility whatsoever that this animal will survive. So Patrick did what he always does, which is come up to Tim and myself at the Alternative Holistic Veterinary Medicine Centre. And Tim saw him first and put her on Arsenicum album 30. And you know, she was in that sort of arsenicum state, restless, chilly, renal failure. It's a great remedy for renal failure. And alfalfa. And alfalfa we use quite a lot in low potency as an appetite stimulant. And it works really, really well. And that's, you know, that's the materia medica for us of alfalfa not eating. Especially these old dogs. You know, it has other effects, as you'll see in the materia medica, but that's how we use it. She improved a little bit, and I saw this was a sort of short consultation. I then got the long consultation, and I put her on Calichlor. Calichlor is one of my, we don't have favourite remedies, do we? But Calichlor is also one of my favourite old dog remedies because it is so effective for animals in renal failure. And it's so simple to prescribe as well. And the prescribing indication is smell of urea on the breath. Now I was taught as a student, you know, there are these things that you get, these symptoms that you get in patients with renal failure. And when you've got all those, you've got renal failure. And it took me a long time to realise it doesn't work that way. And homeopaths know it doesn't work that way. Some dogs have uremic breath, some don't. Some have polydipsia and some don't. Lots of different symptom pictures depending on which remedy state they're in. But Calichlor is great. And it is, if you have a dog and you think it's got renal failure or you know it's got renal failure and you smell it around the mouth and it smells strongly of urea, then Calichlor is what it wants. You probably find there are some grey seated ulcers in the mouth, which is what's in the materia medica or whatever, but it's just that smell of urea. However, do be careful because as most vets will know, old dogs may have a smell of urea from the mouth because they're licking their penis. And they're actually in a benzoic acid state, which is dribbling, foul-smelling urine, which is a perfect opportunity for the classic English dog joke, which is, why do dogs lick their willies? Because they can. I did warn you. So the other thing to say about the benzoic acid state is, I think for me, you know, I really don't want to go through, on a personal level, what I saw my brother go through, which was chemotherapy for cancer. I don't want to go through what I've seen a lot of people go through towards their end stage of life. If I reach the benzoic acid stage and I don't respond to benzoic acid, then we live in Dorset, which for those who don't know is on the south coast of England. There's a beach there called Chesil Bank. There's actually a book written by, forget his name, and they're doing a movie of it at the moment, so we've had film cameras around. But Chesil Bank is a shingle bank, and it drops very quickly into the sea. And the sea around Great Britain generally is bloody cold. And it's cold most of the year in Dorset as well. And it drops in very slowly, so it's a really good place just to walk gently out into the sea. And I have a spot mark there. My great fear is that I'm going to forget where the spot is, but Jane has assured me she'll remind me. And if necessary, we'll take the wheelchair and give it a shove. So, this is how we went on with Maisie. Had a discharge from the mouth, was put on metronidazole by the local vet, who didn't express any surprise that the dog was alive, of course, or comment. SG was measured, and that's pretty good, really. And no protein in a 16-year-old dog is absolutely almost unheard of, to be honest. The blood urea had come down to normal. Dog was well alive. We put her on silica, and we continued. So for the rest of her life, she had arsenicum, alfalfa, and calichlor every day. And then as various things cropped up, we'd add to that. So she'd gone up a couple of kilos. She was bright and inquisitive, trotting better. Started vomiting food. The Materia Medica says about phosphorus when it's been warmed in the stomach. So how long is that? That's really helpful. My experience in dogs is between 5 and 10 minutes. And that's what she was doing. So we gave her phosphorus for a few days, and that settled down. Now 17 years old, not quite so a bit foxed by things. Coat's a bit scurfy, hind legs are going weak, so we put her on conium or conium, depending on which school you're educated in. Hemlock anyway. And 6C, great remedy for old dogs going weak on their back legs. They also tend to get shivery on their back legs, especially when they're defecating. And sometimes they'll have urine that spurts. But it's the weak legs that is the keynote. She then had a stroke. I was taught at university dogs don't have strokes, they have vestibular syndrome, which is a constriction of the artery to the vestibular apparatus, which is why they very often recover, or usually recover. So that was it. Dogs don't get strokes. Meanwhile, George MacLeod, dear George, was teaching us that if you had a dog with a stroke, you gave it arnica because it was a stroke. And we said, yeah, well, you know, George doesn't know these things because we're smart and young and clever. And lo and behold, about 10 years ago, we suddenly had an article in the Veterinary Times that said, hey, dogs get strokes. This is new stuff. Dogs do get strokes. And you can diagnose them in the same way that you can humans. But of course, CAT scans and that sort of thing are pretty expensive. So by and large, the diagnosis is if it has a stroke, if it gets better within 48 hours, then it was a vestibular syndrome, and if it doesn't, then it's a stroke. And that seems to work quite well. I think this was Tim, actually, that recommended this, a mixture of agaricus, cocculus, arnica. So the arnica in case it's a proper stroke. Cocculus works really well when they keep falling over and rolling as if they're drunk. And agaricus, the keynote for that is the nystagmus, lateral nystagmus, which they usually have. So they respond very well to homeopathy. The only thing that has been available in conventional medicine has been corticosteroids, which we know probably makes things worse, and vivitonin. And I don't think there's actually any evidence that vivitonin works. So, but vets don't use medicine that there's no evidence for. Only homeopaths do that. I've read through this recently when I was preparing this talk, and remember that this episode she was dribbling urine, which is a little bit smelly, sometimes straining, large flakes exfoliating from the skin. So that's the calisulf, the large flakes exfoliating from the skin. And interesting, you know, another potassium remedy. She got a bit of keratitis in the left eye. I hadn't seen her for a couple of months, and there was she had some ulceration there. It wasn't staining up with fluorescein, but there had been something there, and there was a little bit of keratitis. So I gave her cannabis sativa. I've never used that in my life before or since, but it worked really well. And I'm not quite sure why I gave it, but I think it was the, looking up in the Materia Medica, it was the combination of the eye problems and the urine. Settle down anyway. Here she is. Here's Elvin Maisie again. 27th of the 9th, 2012. Each day she's improved since she started the tablets. She's a bit confused when she's outside, becomes very bright and with it. She deteriorated a bit because we took her off the tablets, but improved again as soon as we started the tablets again. That was the conium. Conium helps to keep her up on her legs. A few months later, back problems when she doesn't exercise. She's got stuck in a bed from time to time. RRA helps. And if in doubt, if all else fails, examine the patient. On examination, the cervicothoracic area was painful, so she'd obviously got a lesion of some kind around that area. And I find tellurium is a really great remedy for that, just for that area. Sometimes you've got referred pain down the front legs as well. I did a bit of acupuncture on her. She didn't actually like acupuncture very much. Sometimes it aggravated her a bit too much. But we did do the occasional acupuncture. And silica once a day, that was for the runny eyes, and you know, she's very much in a silica state as well. She then started to develop colitis, which can be quite a problem in old dogs. Quite often they get this syndrome where they just become intolerant, leaky gut syndrome, which I'm sure humans get, and they just get intolerant and intolerant and intolerant. One of the things to mention about treating old dogs and diet, yes, it's an obstacle to cure if they're on commercial food, but by the time they've been on it for 10 or 11 years, quite often you can't do too much. And they will also start to become sensitive to food, so you can be restricted on what you can do. So you would love to have them on an organic raw food diet, but quite often you can't do that. And my advice to people is that, you know, this is an old dog. She's not going to be here that long. So let's help her enjoy life. I had an old dog actually. I've had several old dogs, but one of them developed an allergy to any kind of meat. And we did find a vegetarian dried food. I was still giving dry foods in those days, and that was fine. But then slowly he became sensitive to that. And he spent the last 6 years of his life on cheese and chocolate. And he was happy, you know. And now, I mean, that's a Buddhist diet too, isn't it? You know, if you go to a Buddhist retreat centre, a full-on Buddhist centre, then you don't eat after midday. But cheese and chocolate are medicinal, so you can have cheese and chocolate at night time. Yeah, so Tim sent Patrick a mixture of herbs, which helped a bit, but to be honest, we never quite got on top of the colitis. Saw again, effective acupuncture worn off. Tellurium helps enormously, works like paracetamol. Just, you know, this is one of my favourite clients, as you can probably guess as well. Virtually everything he brings does well. And there's something in that, there is something of the genuine placebo effect, that he really does know that things are going to work. But I think it's also because he knows his animals so well. He brings us beautiful histories and makes it very easy to diagnose which remedy to give. Then she had a fit, piercing scream, then a fit with the feet running. She'd had an episode of circling, and he said she's standing by the water bowl licking. I don't think she can see properly. So he's given us the blindness, and he's given us the screaming out before the fit. which is cuprum. You know, it fits cuprum perfectly. So we put her on cuprum for 10 days. A couple of weeks later, she was doing fine, no more fits. She had an episode of a nasal discharge after she'd been here last, but that settled down with transfer factor. I don't know whether you're aware of transfer factor. It's made from colostrum, and it's just an immune modulator. I was hoping I could say that we'd given a core pet, but in this case we didn't. We gave a transfer factor. Had an episode of colitis. Herbal mix helped. Cuprum helps when she's restless, and there's a heart murmur. No clinical signs, so no treatment. There she goes. Then she got urine scalding after a bout of colitis because she weed at the same time, and she got a pressure sore over the hip. Took down to the local vet. Local vet said it's never going to heal, put her to sleep. When I was a young vet, I was warned that there were vets called bump vets, which would bump the dog off at half the, and they still do exist. It was healing. We used hypercal on it, healing, but still some pus, and we used gunpowder. And gunpowder is a fabulous remedy. I have a colleague in Latvia who is unarguably the best equine vet in Latvia, who only joined the course because his wife wanted to learn homeopathy, and is now only does homeopathy. And gunpowder is his favourite remedy. So speed up. Podophyllum and Psychotic-Co for the colitis didn't quite help. Cicale for the pressure sore, and back. Argentum in humans is the pain's best when you lean over. So in animals, that's arching the back. So another area where the terminology is different. Still having episodes of colitis, a bit vacant, Britacarb and some Gärtner. So there we are. I'll just briefly run through the his story. She'd lived as a soul dog in a Christian community, had neurological episodes before, poor teeth, mouth hygiene. Weight was 8.4 kilos. Vet advised immediate euthanasia. Blood urine nitrogen was 151. 6 and 8 months later, all kidney levels were normal, so we stopped testing her after that. Up to 10k. Here was the wound. Looks horrible, but it healed up completely. We used antibiotics as well as a complementary therapy. And then finally, she had the colitis, which we never quite got on top of, but she died at 18.5 years. Death was imminent. Would have died anyway. So that was Maisie. I think we'll skip Katie. Oh, okay, all right, Katie. Well, very, very quick Katie. Katie came originally with a chronic lesion on her toe, which and the vets wanted to amputate it, and actually silica sorted it. But she also had dropped wrists and arthritis, rheumatoid arthritis, all 4 feet, and she got dropped wrists. Dropped wrists in humans is different, isn't it? So in animals, because it's weight bearing, the wrist drops like that, whereas your dropped wrist is this, I think, isn't it? Yeah. Yeah, it broke open on silica. It broke open. She went back to the vets, had steroids again, and it healed over. So we used silica, and it all broke open and then healed. Actius spicata was the remedy which really helped with her for wrist arthritis, and she came back at 12 years old, so many years later. And the remedies we used were Strophanthus, Argent Met, Camomilla, Actius spicata, Costum conium digitalis. So we haven't time to go through all those remedies now, but She lasted another 3 or 4 years, finally put to sleep at the age of 17. That's when she was 15. Happy dog, happy dog. Okay, so we're coming to the end. Have I got 5? Right. Okay, that's 3 slides a minute. So what are we going to do? We want to honour the life of a sentient being as they pass from this lifetime. Whether you feel they're going on to the next or not is up to you to decide. But the important thing is they pass on without fear or pain. Flagged off early. Yeah, there we go. Great, thanks. This is the difference. Conventional treatment, slow deterioration, slow loss of appetite, quite a lot of pain, slow loss of faculties and demeanour, and they go down and down and down and down and down, and nobody knows whether to put them to sleep or not, and owners come back to the vet, say, do you think we should put her to sleep? They say, oh, well, maybe, yeah. Or the neighbours say, it's time you put that dog to sleep, and nobody's quite sure what's going to happen. With homeopathic treatment, they go down in little steps. Yeah, trot, 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 and then drop a little bit, and trot, trot, trot. Sometimes the symptoms change, so you have to change the medicines. And then at the end, they suddenly collapse, and they die naturally, or something catastrophic happens, like they have a fit, a stroke, cardiac failure, renal failure, acute renal failure. Something happens to say, now's the time. And I've heard this from a friend of mine, Ian Billinghurst, who started off the bones and raw food issue with his book, Give Your Dog a Bone. And he says that same thing happens. If you feed a dog naturally, they live a long life and a happy life, and then they die. And that's what we're supposed to do. And we don't do that because conventional medicine stops us doing it. So when you put a dog to sleep, you might find this useful in another 20 years' time. To me, there's a balancing act. Positive things, appetite, exercise and love, and knowing that you're loved, so the brain's got to be okay. And on the other side, the negative things, pain and fear, loneliness, those sorts of things. And when it tips, when it gets absolutely balanced, that's the time to think about it, and when it tips, that's the time to go. But it's quite easy, and it's quite simple. Beware recommendations for euthanasia. He's not going to get any better or to save him from suffering. The dogs that go off their back legs, they usually come to us and the vet has said, it's got CDRM, it's going to be paralysed in 3 months' time, put it to sleep now. That's very, very common, and it's getting worse actually. I have a friend who's a veterinary student, and the criteria they're given for euthanasia is actually far away from what it should be. Let's put it that way. We can help them to die naturally. They need to be terminal when we put this into action, otherwise nothing happens. Arsenicum album, 1M, preferably 10M, every couple of hours. And there's all sorts of stories I could tell you of my own and other vets' experiences of the value of Arsenicum 10M close to death. Withdraw food, I sort of put that in there just to suggest that I don't think we should withdraw food. And you can take that at face value as far as dogs are concerned, and also my opinion personally about people. Particularly with dogs, you know, the one thing they really enjoy is eating. So don't make them die by starvation. So euthanasia, what we try and do, we take the time, we do it at home if we can. You may need to take an assistant. If you do it at the clinic, then wait till everybody's gone. Horror stories of people taking their dogs into vets and having to sit in a crowded waiting room for half an hour before they're taken in. Get the practical stuff out of the way. We have to sign a form these days. You've got to sign a consent form for everything. and get them to pay then, and then it's done. And then when it's all finished, they can move on. Homeopathic care is the most important thing. We can use things to help the patient through. And take care of the owner. So let them say goodbye, don't rush it. Some people come and light candles and chant, other people pray, other people just want to sit still there. Allow them time in the waiting room afterwards, give them a cup of tea, and treat the animal with respect. There are also horror stories I could tell from my previous existence as a regular vet doing locums of how animals are disposed of, and it's got better, but I still don't think there is enough respect given. You know, the Tibetans reckon it takes us 48 hours, I think, doesn't it, for the soul to leave the body. I think it happens more quickly with dogs, but I leave them if I can for 2 or 3 hours before I do anything with them. Let's take care of the owner. Ignatia, fabulous. Give them a book to write in. Send them a card. And beware. Be aware that the animal companions are going to become depressed. Treat them as well. They may show no emotional changes, but then a fortnight later they're back with renal failure, or in a Staphys agrias state or an aurum state. So that is the end. That's where Bunny finished up. The final note is that if we do it skillfully and with compassion, it can be a positive thing. And back to what I was talking about dying patients, vets keep their patients, their clients, far more on what they do when the dog dies than what they do when the dog's alive. That's such an important, it's the most important time in client relations, and it's the most important time for the dog. And Bunny will tell you that. Okay, thank you.